Good afternoon. We are here at CROI 2013 with Dr. Robert Grant. He's professor of medicine at the University of California in San Francisco, and he's also the chair of the IPREX trial.
Thank you, Charo. It's a pleasure.
So we are going to talk something about the PrEP. So which was the most important result on the IPREX trial that used this chemoprophylaxis strategy?
So the idea of PrEP is to see if a pill taken once a day can prevent people from acquiring HIV infection after sexual exposure. And what we learned is that the pill that contains two different medications, one called tenofovir, another called emtricitabine, together it's called Truvada, that pill, when taken once a day, can dramatically decrease the risk of acquiring HIV. The level of protection was 99% among those taking the pill 7 days a week or every day, and there was 96% reduction in HIV risk among those who were taking the pill 4 or more times per week. This has now been approved by the Food and Drug Administration in the United States, and there is guidance from the Centers for Disease Control on how to use it. We do recommend that this prevention pill be used daily, because when people use it daily, there's some forgiveness for missed doses. And we know that no one is perfect, and that if people try to take something daily, there may sometimes be a missed dose.
And it's a challenging situation because it's prevention. So you are trying that the people take this pill and they are no infection. Mm-hmm. So how did you manage these structural factors in the adherence in the participants of the trial?
So it's important that everyone realize that the pill itself will only protect people from HIV if they take the pill. Mm-hmm. And taking a pill once a day for prevention is difficult for many people. They have to build it into their lives. The most important thing we learned was that over time, if people can make it part of their daily routine, they can take it once a day. But even before that, I think people need to think through how they are going to stay free of HIV. Every one of us who knows about HIV realizes that it's a deadly disease that, when acquired, requires lifelong therapy. But not all of us have really thought through our approaches for how to stay free of HIV. And there's many approaches. Condoms, when used every single time, can be highly effective. There's also ways of communicating effectively with your partners about HIV test results. And getting yourself HIV tested is critically important. Taking a prevention pill is one option that now is available. And it's been shown to be effective for men who have sex with men, gay men, trans women, and heterosexual men and women as well. But people who want to use the prevention pill need to realize that it has to be taken every day or nearly every day, and that means changes in their daily routine. Plus, they have to see a healthcare provider to get PrEP.
And you practice on the trial this kind of new approach in the counseling, mm-hmm. Some steps trying to focus on the factors that make difficult and facilitate the taking the pill for the participants.
Yeah, I think our counseling approach has been focused very much on what each person needs, because mm-hmm. every one of us is different from everyone else, and we all have different perspectives, different needs, different strengths, different weaknesses, mm-hmm. and I think that any counseling approach about HIV prevention, including the use of prevention pills and how to foster adherence so that these pills are used effectively, these approaches have to be tailored and customized to every single person. And so we suggest and encourage the counselors to find out whatever they can about the person that they're giving counseling to. Mm-hmm. How do they want to protect themselves? What kinds of patterns of adherence will work for them? We call this tailored approach client-centered.
Yeah.
Sometimes we call it next step counseling because we realize that the counselor will be interacting frequently with the person, and they don't have to get everything right the first time. They can take steps toward protecting themselves more and more. So we call it next step counseling, so that every time the person sees the counselor, they're talking about what is the next step for that person to get more and more safe from HIV.
Mm-hmm. And you are now working in an extended trial. Mm-hmm. And what is the main goal of this trial known as IPREX-OLE?
So we call IPREX-OLE for open label extension. Everyone who was in the previous study is welcome to join the extended trial. The main point is how well can PrEP be used in real life? When we give people the tablets and we tell them what they are, there's no placebos being used at this time because we know that the tablets containing the active drug are much better than a placebo. And so we're giving people real tablets with real information and helping them find ways to integrate that into their own lives. And so this is the point of IPREX-OLE, is really to see how well people can use the prevention pill in real life.
And one of the main concerns about some of the community leaders that in different countries where the IPREX-OLE trial is running, they said about this sexual disinhibition. Is that happening? How you are the crew of IPREX are dealing with this? Is really happening with the participants?
Actually, we see the opposite. The concern that you've raised is that people who are given a prevention pill might just have more sex or stop using condoms or become riskier in some way. We did not see that. In fact, we saw the opposite.
And you present IPREX as a combination of...
Right. Yeah, we actually saw the opposite. People tended to become safer during the study, and we think that's because they came in looking for a prevention pill, but they also received HIV testing and the results and counseling, and they become part of a community which is all focused on staying free of HIV. And once they have friends who are also talking and thinking about staying free of HIV, they start to learn and they start to develop plans for themselves. And so we think those are the reasons why people have become safer over the course of their PrEP use.
Mm-hmm. And did you agree that PrEP could be recommended for specific populations?
Oh, I think PrEP should be considered by anyone who has sexual partners and who is not using condoms every single time. And so I think that the people who will benefit most from PrEP are gay men and trans women, and heterosexual men and women who have partners who are HIV infected. But I think it can be considered by anyone who has sexual partners. Sex workers would be another group, although some sex workers can protect themselves with condoms because they can insist on them every time. Other sex workers are not able to use condoms every single time. So PrEP is an option for everyone to consider. Whether they actually use PrEP will depend on whether they think that's the best way for them to stay free of HIV. There's other approaches. Consistent use of condoms works. Really close and good communication with your partners also is highly effective. But I think PrEP is a good option for many people.
So thank you very much, Dr. Grant. And we finish.